Hi, I'm Dr. Tom Hyde, a board-certified lipidologist with CardioSound, and I'm talking today about heart attack survival statistics for women. The statistics are different for women than for men, so I think it's important to know what these statistics are. Did you know that almost 2/3 of women who die suddenly from a heart attack have no idea they have heart disease? That's much higher than men. There are some tests, some screening tests, that can tell you whether you have high risk for a heart attack. Ultrasound tests can do that if you measure the thickness of the plaque. Heart calcium scans can also do that. One study in heart calcium scans, called the MESA trial, with 16,000 patients referred by their primary care doctor or by their cardiologist to get this heart calcium scan to ask the question whether someone was at high risk for heart attacks. Males were almost twice as likely to be referred as females. You know, if more women were being screened to find artery disease early, then probably less women would be having heart attacks. So, what are the statistics for women who have a heart attack? More women than men die in the hospital after the heart attack. And that's true both for women who have a STEMI, which is the most severe type of heart attack, and a non-STEMI. Those women who survive a heart attack, though, often are not told about the statistics in terms of the risk they face after they leave the hospital. And I don't think that's a good thing. We just don't talk about your risk going forward. I think we should. I think you do better when you know what risks you face. So here they are. 1 of 13 women who survive a STEMI die within the first 30 days afterwards. Remember, that's the severe type. 1 in 20 women with a non-STEMI heart attack die in the first 30 days. We usually treat heart attack survivors with a statin drug, blood pressure pills, and a blood thinner. What if you don't have the standard traditional risk factors? This study from Sweden with 62,000 STEMI patients compared those with and without traditional risk factors. And by traditional risk factors, I mean cholesterol, high blood pressure, diabetes, and smoking. Now, compared to other women with traditional risk factors, women without those risk factors carry higher risks. 1 in 6 women, 17%, without traditional risk factors don't make it 30 days after a STEMI. So these factors are hugely important at 30 days, predictors of risk in women. Any heart attack, even the less severe non-STEMI, 1 in 20 die in 30 days. If it's a STEMI, 1 in 13. If it's a STEMI plus you have no traditional risk factors, 1 in 6. Of heart attack survivors 45 and older, 1 in 4 women will die within 1 year. What's the 5-year risk? About 1 in 2 women will not survive 5 years. What about 8 years? Most women die within 8 years. About 65% of women don't survive 8 years. Now, let's say you've just survived a heart attack and you've been sent home with your blood pressure medicine, your statin drug, and a blood thinner. What should you do next? I think the most important survival characteristic is that you be curious. Ask the right questions. What causes heart attacks? Does blockage cause heart attacks? Inflammation is what causes heart attacks. Inflammation in the arteries. So you should be asking what caused my heart attack. Was it your cholesterol, blood pressure? What if you have other risk factors? What if you have non-traditional risk factors that haven't been discovered because they've never been checked? You need to track it down. Be relentless. You need to know every single thing that caused the inflammation in your arteries. If you can identify everything that led up to your heart attack, you'll be much more equipped to prevent another one. When should you start this quest to find out? I think immediately. And you should start treatment without delay. We have 100% survival rate after the heart attack. One of the reasons is because we tell people what their risks are and they get engaged with the process to fight every single risk factor. So if you've just had a heart attack, the best time to start is right now. Start your testing as soon as possible.